Hi, and welcome to East Tennessee and Company. I'm Sherry Ayler. If you've worn glasses or contacts for a long time, you probably have wanted to be able to see without them. No matter how ready you are to reduce or eliminate your need for corrective lens, the decision to have LASIK is a big one, and you want to know that you're getting the safest, most trusted treatment available. Here to tell us more about LASIK is Dr. Les Cunningham from Campbell Cunningham Laser Center. Thank you for being here today.
Glad to be with you.
So tell me, what is LASIK?
Well, it's the technical term is kind of a medical mouthful, but essentially LASIK is laser vision correction that involves creating a corneal flap and then using another laser to treat the patient's prescription.
And they used to use a knife, but now it's a laser. And how long does that take to do?
Well, the state of the art now is, you're right, it used to be what's called a microkeratome, and that was great, but the setup that we have now is called an intralace, which is a blade-free laser that's used to actually create the flap, and that plus the Visex laser that we have is exactly the same thing they use on Navy pilots.
Well, that's impressive.
Yeah, it's pretty cool technology.
Yeah.
And typically the patient is there. The procedure is you come in for a consult, then you'll come back for about a 2-hour preoperative exam. The day of surgery, you're given some numbing drops in your eyes and a little bit of oral sedation. And the surgery itself takes about 10 minutes. You're there about an hour, and we see you back the next day. And most people see well enough to drive themselves in the next day.
That's impressive. And so there's going to be a lot of people out there who are going to want to know, am I a candidate? So who's a candidate for this?
Well, most people are candidates for some type of laser vision correction or refractive surgery, I should say. There are lots of newer technologies that are out there as well. Most people are typically candidates for the laser vision correction. 18 to 21 is kind of iffy, although we prefer patients to be 21, have a stable prescription, they're be in good health, and their eyes not to have any other type of pathology. And really, the fact of the matter is most patients really are good LASIK candidates.
And what kind of benefits should they expect after having this done?
Well,
besides seeing clearly.
Right. Well, it's interesting because the most common comment I get is people are thrilled to be able to see the alarm clock when they wake up in the morning without glasses and contacts. And, you know, we live in a beautiful part of the world here, and it's getting ready to be fall, and we have spectacular falls here, and people love going to the ball games, and it's great to be able to experience all that without the hassle of glasses and contacts.
Well, does insurance of any kind, Medicare, regular insurance, pay for any part of the procedure?
Typically not, although some vision plans do provide a partial benefit. And of course, we have great financing options, and we can make it affordable for almost anyone that's interested. And
what risk might be involved in this type surgery?
Well, no surgery, including eye surgery, including LASIK, is without risks, and it's really important to choose your surgeon carefully. You want to go to a center that's had a lot of experience, has a low complication rate, and a center where the doctor is going to take the time to answer all your questions and discuss the risks as well as the benefits.
And will there be any discomfort afterwards for an extended period of time? What's the healing process like?
Well, not typically for an extended period of time. Most people get their best vision within the first 2 to 3 weeks. It's certainly possible to have increased foreign body sensation, scratchiness, increase in dry eyes, and those are the most common side effects. But we anticipate that, and we give the patient drops and medications and good instructions to help them deal with that.
Quick question. If someone's considering this and they come in to see you, how long would they have to wait before they could go ahead and book an appointment to get it done?
Well, typically we can see consults the same week, and usually the next week or two we can get you in for pre-op and surgery. Well,
that can happen really quickly. And for more information about getting your vision corrected with LASIK, then go to Campbell Cunningham Laser Center. Their phone number is 588-EYES, which is a really cool one. And you can visit them also at ccteyes.com, or you can go to our website, East Tennessee and Company. We want to thank Campbell Cunningham Laser Center for paying for today's segment. We want to thank you, Doctor, for coming in. We want to thank you for joining us. We'll see you again next time on East Tennessee and Company.